Joining me on the program now, though, is Minister for Mental Health, Matt Doocey. Minister, kia ora, thank you so much for your time today.
Kia ora, afternoon, Andrew, and big hello to all your listeners today.
Now, this is a significant problem. In terms of how we measure that, though, is the problem getting worse, or are we just getting better at recognising, at diagnosing, at providing treatment, in your opinion?
Yeah, I think that's a fair question, Andrew, and I'd probably say a bit of both. I think in today's world, there is potentially a bit more stress, a bit more pressure. Think of the use of technology and other difficult environments, but I also think that part of it is actually a success, if I could be as bold to say that, New Zealand is now a country where we more openly talk about mental health. There's
Yeah.
less stigma and discrimination than maybe when me and you were a bit younger. Young people have a vocabulary to talk about mental health. We never did. And they're more open to talking about their needs and asking for help. So, my real focus now is as people ask for help, we need to make sure that support is there.
And this is the challenge, really, as there are more and more people asking for help and making sure that there is access to mental health services, that there is access to counselling and support and intervention where needed. Difficult with your role as minister to make sure that that support is there.
Yeah, very much so. But look, I'm up for the challenge. I'm New Zealand's first mental health minister. I thought it was time we had a minister solely focused on this issue. But let's be very clear, just giving someone a job title doesn't make a difference. It's what we use the role for. But, we've recently set the first access targets for mental health in the history of New Zealand, 1 week for primary, 3 week for specialist. But part of what we're announcing today is Mental Health Awareness Week is the Top Up Together campaign. That's about topping up your mental meter. See, mental health can't be just about eliminating mental distress. It's also about promoting mental well-being. And I'd encourage people to go up to the Top Up Wellbeing website. You can actually learn 5 techniques, the 5 ways of well-being, and if you implement them in your day every life, in your life every day, it's evidence-based to improve your well-being. And I think that's really exciting that people can implement those strategies and improve their daily well-being.
You talked beforehand about some of the stresses of busy life and particularly life online. And there's a bit of concern that there may be some social contagion in this space, that good old Dr. Google, hey, I'm not feeling that well, I go online, I do a quiz, turns out that I have this medical condition. Part of the problem here, people self-diagnosing, jumping to conclusions rather than getting the clinical support and the appropriate diagnosis?
I think there's always a risk of that. And look, we're all human. We're all a bit guilty of that, jumping online and seeing what comes up on the search engine. But I would say to you is that the health survey comes out every year from the Ministry of Health, and there is a measurement of what they call unmet need. Now, classically in mental health, unmet need is people with mental health issues who need support and can't get it.
Yeah.
And we all think the unmet need is based on lack of support. But when we drilled into the data, we found over a third of people were reporting unmet need because they didn't know where to go, which is quite staggering, like you say,
Yeah.
with Dr. Google. So actually, the technology and the internet and AI is a huge opportunity to actually connect people with the local services around the corner that they weren't aware of.
And hey, part of the answer, not necessarily just the part of the problem in that regard. What does success look like in this space? Because, of course, mental well-being, that is on a spectrum, and people have good days and bad days, and it's a problem that will never be solved as such. But how do you measure success in this space, Minister?
Yeah, it's a really good question. And look, being anxious and being stressed are quite normal for being human beings.
Yep.
And we should understand that. And actually, you can learn the skills and the techniques and the education to support yourself through those periods of life. But I'm in quite a privileged position. I get to travel the country talking mental health, and largely the feedback from the front line for people who engage in mental health services is that they find a very fragmented system and it just takes too long to be seen. So
Yeah.
part of my role is to join up the system and also ensure that people get timely access to support. So that's why we set the first mental health targets for those engaging in primary mental health and addiction support to be seen within 1 week, and for those who need specialist support to be seen in 3 weeks. And that's one way of measuring performance and success as well. But ultimately, what we want to do also is have an environment, have a culture where people feel like they can actually be more open about talking about mental health, face less stigma and discrimination, and actually realise that we are all in it together. We have good days and bad days, as you said, Andrew, and have an environment where people feel supported.
Just finally on this one, for people listening to this, and Mental Health Awareness Week, now, honestly, in my opinion, that should be every week, but let's make the most of this opportunity and the media spotlight that it brings. For people that are saying, hey, hearing a lot about this week, and honestly, I've been struggling for a while, but I've just been batting it away and saying, no, I'm not gonna go there. I'm just gonna pull myself together and get on with it. But hey, keeps coming back around that there's possibly some real struggles in this area. What advice would you give? What's the first step for somebody who's in that space of saying, you know what, maybe this is something I need some professional support on, maybe this is something that needs checking out?
Well, the first thing I'd say is, welcome that discussion internally with yourself, because what it says is you're checking in on yourself, you're becoming more aware of a potential issue or concern, and actually you're working out whether you need to talk to someone or get the support. And I think that's a good thing to have awareness as well. And what I would say is actually in New Zealand, there is a lot of things that people can access for free.
Yeah.
I've put it to you, you can go to the Wellbeing Top Up website, learn about the techniques to apply every day to support your well-being. You can call 1737 24 hours a day, 7 days a week, and talk for free to a trained counsellor. That's a great service.
Yeah.
And also there's a program called Access and Choice in your GP clinics where you can go to a GP. You don't need to see your GP first. You can see a mental health practitioner for free as well. So there is a lot of support out there, but ultimately it just comes down to when the person is ready.
Yeah.
And maybe it's not necessarily reaching out for help straight away. It's just confiding into someone next to you about how you're feeling. And I must say in mental health, that is the real magic, right? It's just sharing your experience. And quite often you'll sit down and there'll be someone who says, actually, do you know what? I've been there before, and this is what I did. Not to tell you what to do, but just to share the story and to let you know that there is light and hope at the end of the journey.
And Minister, thank you for the work that you do. Thanks for taking the time to chat with us.
Thank you very much, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.